Good morning, Namaskar. I'm back to you. Yesterday I could not do successfully, but again I'm trying today. This 18th, January 18th, 2021. And Monday, of course, yesterday was Sunday, on 17th January. And of course, we should expect less number of cases. And that's true. And I was just reading a news that in Yahoo it is. They claim Bharat, India has lowest number of fatalities and lowest number of cases. And I was laughing on that. Very good. I enjoy it because fake news, fabrication news, they catch up. They don't catch up reality of life, and this is what is happening. झूठ बोले कौवा काटे काले कौवे से नहीं हो. हमारी सरकार झूठ बोलने से नहीं डरती और न्यूज़पेपर्स भी झूठ बोलने से नहीं डरते. शायद उन्हें शर्म नहीं आती. उनके पास चिल्लू भर पानी नहीं है डूब मरने के लिए. कब तक सच्चाई छुपाएंगे आप? सच्चाई नहीं छुप सकती, जितना मर्जी झूठ बोल लीजिए आप. Fact remains, you cannot rely on fake statements, false statements. Fact is that you are doing nothing and you are telling we have done best. This is problem in this country. Well, title is Bharat India. An analytical informative talk on COVID-19 plus variant. Strain status for January 17, 2021. Reported on January 18, 2021. That is today, Monday. Government provided database worked out spreadsheet. File screen share for national awareness for government has been sleeping and people also sleeping. Well, I have no fun in criticizing someone and I'm not criticizing anyone. I'm just trying to give you certain facts. You can see on this screen. What is given? It is yesterday's tally, you can say. Yesterday's information of given today, and that is there were 18.709 crores people tested, and yesterday only 5,48,168 tested. Now this is really shameful I can say. If you compare it to end day of year 2020, it is 106% down. Shameful really. You could not even test 7 lakhs, 8 lakhs, 9 lakhs, 10 lakhs, 11 lakhs, and you are laughing and you are clapping on your success. This is called foolishness, and I don't agree with that. I will come back to this. And their total number of infections so far, and this is yesterday only, they claim 13,788 positive cases. 13,788 हुए हैं जी. और बड़ी तड़ी से याहू न्यूज़ दे रहा है और दूसरे अखबार न्यूज़ दे रहे हैं. बाकी सब भूल जाओ. ये देखो कि कितने केस हुए हैं और ये देखो कि कितने लोग मरे. हमें क्या लेना देना है बाकी से? बाकी हमारा काम नहीं है. अपने आप छोड़ दो उसको. लेकिन हम नहीं छोड़ेंगे. हम एनालिसिस करेंगे. आपको जो करना है कर लीजिए. Up till now, 1.057 crore cases have been recorded, and this is virtual information about yesterday. And before going further, I will like to go, and you can see this graph as well. Again, it is laughing. This teeth are now, it's very good. Undesigned teeth, you can say. Teeth of some animals, you can say. These are teeth of some animals rather than laugh. So I should turn this way, it's better. Now come on to sheet 5, which is yesterday's announcement by government. And what does it say? Let me see whether it is same as before yesterday, 9.8. No, it's new one. So this is a report on 18th, and for 17th this is. And you can say this all government provided information. I just copied and pasted on this, nothing else. All other, our work. Now we can say Maharashtra, 19.91 lakhs. I'm just speaking shorts, not to speak everything. Karnataka, 9.32 lakhs. Andhra 8.86 lakhs, Kerala 8.48 lakhs, Tamil Nadu 8.31 lakhs, Delhi 6.32 lakhs, Uttar Pradesh 5.97 lakhs, West Bengal 5.65 lakhs, Odisha 3.33 lakhs, Rajasthan 3.15 lakhs, Chhattisgarh 2.94 lakhs, Telangana 2.92 lakhs, Haryana 2.66 lakhs, Bihar 2.58 lakhs, Gujarat 2.56 lakhs, Madhya Pradesh 2.52 lakhs, Assam 2.17 lakhs, Punjab 1.71 lakhs, Jammu Kashmir 1.23 lakhs, Jharkhand 1.18 lakhs, Uttarakhand 9.48 lakhs. Himachal Pradesh 5.7 lakhs, Goa 5.24 lakhs, Pondicherry, I'm sorry, 5.24, yes, yeah, 5240, not lakhs, I'm sorry, in Uttarakhand 94,803, Himachal Pradesh 5694, up to Jharkhand it is in lakhs. Himachal Pradesh 5694, Goa 5240, Pondicherry 3864, Tripura 333, and Manipur 2885, Chandigarh 2553, Arunachal Pradesh 168, Meghalaya 1370 is 1370, Nagaland 120, Ladakh 96, Sikkim 60, Andaman Nicobar 49, Mizoram 43, Dadra Nagar Haveli 33, Lakshadweep 0. These are active cases, you can say total cases, you can say not active exactly, total cases till yesterday. This is update. And then, yes, active and discharge and death ratios are here, which I am going to just link here. And it is a surprise that they keep 1.2% death all time for many days, for many weeks. I've been noting it is only in this range. I don't understand reason behind that. What reason? Is it natural 1.2% over there? They are maintaining this, and 1.42% are active cases. And if you see yesterday also it is 1.45. There is a little variation in active cases and also little variation in discharge cases, but they are maintaining, I don't know under what designs they are maintaining, only they can know. I can't comment on that. मैं उस पर कुछ नहीं कहूँगा किस तरह से वो 1.2 फिगर डेथ को रखे हुए हैं, वो कौन सा फार्मूला है, वो किस तरह से डाटा रखते हैं, भगवान जाने, ऊपर वाला जाने उनके डिज़ाइन क्या हैं. Well, 2.63% is this and this, that is active cases, and deaths while remaining are discharge cases. So I have projected to you this detail, this data. That is, means if we consider this 1.2% and 1.42% separately as well as in combination, we will find what type of graph it comes in. 1.2 result is here, for a period of 2 months at a frequency or interval of 3 months, we can say these percentages would appear in. When we say that for a frequency of 3 months or interval of 3 months, 0.25% augmentation is applied on that. So this 1.2 goes to 1.51, 1.88, 2.35, 2.94, 3.68, 4.59, 5.7, 7.18. And active cases, that is 1.42 here, which goes to 1.78, 2.22, 2.77, 3.47, 4.34, 5.42, 6.77, 8.47. And these are gross death. Means gross death and gross active cases. Deaths are 1.57 to 9.33 crores in a period of 2 years, keeping abreast 130 crore population. And active cases are these, keeping abreast this. And if you can see graph of this is combined graph of all this information. This information is all on this graph here. You can see that one here, all is selected automatically, and this information is there. And also, if you say this is graph of active cases and death and rising mountain, you can say this is every day you can see, and every day I put new information or better information. And government claims that they are doing everything possible to remove or to eliminate, how to fight with COVID, and there's nothing left on every stone they are turning. They are only telling this without doing anything. They are saying they are asking people to follow what ministry says. They are still saying, but I am saying, sir, they are saying indirectly, though not clearly, treat yourself, vaccinate yourself, isolate yourself, oxygen, ventilator, all your expenses, your self-expenses. Government of India won't do anything, only testing you have to pay, treatment you have to pay, post-discharge requirement you have to pay, vaccine yourself, everything yourself. They just give credit to government. That's it. So you spend lakhs of rupees with you to treat yourself. That's what beauty of this is. But what is more important is this. बहुत ज़रूरी है इसको समझना. ये जो कुछ सेल्स में ये बात है, करीब 13 to 39 cells में जो ये लिखा है, in 39 cells this is very important, and we have to be very, very careful. 39 or 36 means there are controls required according to medical science or according to health, that how many persons you have tested and how many you are going to test, what is the schedule of testing, what is the schedule of treatment, and what is the schedule of discharge case handling, as well as new one, that is vaccination schedule. That is very important. And if you see on sheet 1, here I put in here certain thing, if you can understand this. Vaccination for, because you cannot check who is infected or not infected, for purpose of vaccination or immunity vaccination I can call it, all public should be tested, and that is 130 crore people. And in 91 days you have to set a program, though there's no program at all, but I presume this is 91 days. Let us presume, if you presume 91 days and you agree with that temporarily, it takes, you can say, it takes, vaccination inoculation for 1.425 crore people a day. 1.245 crore, 1 करोड़ 42 लाख से ज़्यादा लोगों का एक दिन में वैक्सीनेशन करना पड़ेगा, तब आप 91 दिन में सबको वैक्सीनेट कर पाएंगे। और नहीं करेंगे तो आप देख लीजिए, दूसरा है हमारे पास आंसर कि आप 6 महीने ले लीजिए तो आपको 71,24,000 लोगों को वैक्सीनेट करना पड़ेगा। ये बताता है ग्राफ आपके सामने, हंस लीजिए देख के इसको। और यह मैं फिर आई एम जस्ट गोइंग बैक टू दैट sequence of entries, today entries, and if you see these 4 cells here, these cells are here, you can see these cells. 13,788 cases out of 54,081, which is 2.52%. Still, percentage of exposure or percentage of positive effect are more. It is 2.52, previously it was less, you can see, and here also it was more. So average is 2.212, which is 2.76 crores per day. We have to understand like this. It's not simply that I say you agree or you. I am giving a total analysis based on these five items. Item 1, item 2, item 3, item 4, item 5. These items, total test update, daily tests conducted individually, infection update, daily positive cases, and that update. This is most important point which you have to understand. And based on this information from government website, I am working out all this. I work out all this data, and now it says that 14.392% people have been tested, which is amount of population is 18.71 crore. Still, 85.61% people stand without test, which is 111.3 crores. 111.3 crore people do not know about them, whether or not infection exists or it doesn't exist. This is point where we have to check in, because this is warning. And also this is warning which says 9 crore people according to data, because this is 14 points, so it is 7 times this one and it is that one. They say 1 crore, we say 9 crore. This is only difference. And I say, according to my assessment, it is 35 crore. Big difference. Big difference. And charts also say something likewise, You can say these charts are speaking something, and you can sum up these 2 crores, you will find real answer. If you sum up this, you will know what is here also. If you, for example, I say, let me sum here, or I sum here, or anywhere. Let us say we sum something here, and we say, okay, I make sum of these 2 entries. So this is 20.34 crores in this period, 20.234 crores. So just think of this. That's what I'm saying. We have to be and we have to find solutions to these problems which we have not found, and we do not know anything about that. And because we are sleeping, we cannot decide what is detail of control 1, what is detail of control 2, and what is detail of control 3, and what is new, that is control 4, immunity vaccination. No plans Nothing. They just say 3 crores in many months. But I say every day you have to infect 1.4 crore people. I'm sorry, you have to immunity, you have to provide for 1.3 crore people, 4 crore people according to the requirement, or 70 lakh if you want to require to finish in 6 months. So we have to understand it differently and like this. And that's what I put on my post also, something, and that I can read fast for you. And this already there on text, but I'm just reading for you. And it says that why government of India be fooling people and world by showing lesser number of fatalities and also lower number of infections? Why should we as a nation hide facts in health relation? हम क्यों झूठ बोल रहे हैं दुनिया के सामने, पब्लिक को क्यों बेवकूफ़ बनाया जा रहा है कि बहुत कम केस हो गए हैं, बहुत कम मौतें हो रही हैं, बहुत कम इन्फेक्शन हो रही हैं, क्यों झूठ बोला जा रहा है? हम जानते हैं ऐसा नहीं है. हम एक राष्ट्र हैं, सच बोलना हेल्थ के मामले में आवश्यक है ताकि हम समझ पाएं कि हम किस प्रॉब्लम है. इसमें कोई राजनीति नहीं आनी चाहिए. No risk controls, no answer from nation. Do not be deceived by vaccines, no hints for risk mitigation or marginal erosion. Then you can say, do not be misled by vaccines because of no treatment, but to augment immunity level only. People shall have to pay for vaccines except for frontline workers, and no plans are provided for provision action even. And alert is Bharat India, and alert is that there have been 102 cases of strain variant so far as per report, and maybe more, and inoculation of vaccines. What is the schedule for 130 crore public? 1.45 crore vaccinations are required to be delivered and applied or injected to people every day, 1.45 crores per day, so that this work is done in 91 days. And it can be delayed for years, as it says. You require how many days? You can see this file. You require 1120 days, 23 days for even for testing. So what about inoculation? 91 days. We can't be allowed more than 91 days. We have to be very careful in this. Now, it can't be delayed for years. We have failed in testing of population at all levels because 86% people have not been brought to test in more than 324 days. All these citizens belong to poor and lower middle classes. Ministry publishes 85% fake results only. How can ministry claim that COVID-19 has been brought under control? Just the testing of 14.392% population, which is nowhere consistent but ridiculous statement. Whole world must laugh at our performance of testing. With current speed, that shall take more than 3 years for accomplishment of testing. Same may apply to inoculation of immunity providing vaccines if no schedule is prepared for its implementation. It's also alerted that Norway has reported deaths of 25 veterans post inoculation of vaccination. All studies must be made prior to resorting to abusive and negligent acts so that undue hardship losses may not be allowed to all those who are prone to such bad incidents. ध्यान रखना पड़ेगा कि वैक्सीन किन पर इफेक्ट कर रहा है, किन पर नहीं. बूढ़ों पर लगता है ये इफेक्ट नहीं करेगा और उनको मार देगा, ऐसा सामने आया है. और जो नया ये आजकल वैक्सीन ये जो कोविड-19 है, ये प्रभाव डाल रहा है यंग पे ज़्यादा प्रभाव डाल रहा है, जो दोबारा केस आ रहे हैं और जो नया आ रहा है. Now government of India claims, what they claim is hawks and futile and non-realistic. Government of India, I'm quoting that, Government of India is taking all necessary steps to ensure that we are prepared well to face challenge and threat posed by growing pandemic of COVID-19 coronavirus. With active support of people of India, with active support of people of India, we have been able to contain spread of virus in our country. Most important factor in preventing the spread of virus locally is to empower citizens with right information and taking precautions per advisory issued by Ministry of Health and Family Welfare, unquote. You understand what they are doing. They are not doing anything, but they are saying we have won over this. Now, what actually we say, I say conclusively that facts are ensure safety, test self, treat self, vaccine self, isolate self. Oxygen self, ventilator self, etc. Do all activities yourself on your own without depending on government. Self means on patient's expenses. Give government only credit. Credit of those discharged, credit of all controls. But government doesn't understand those who are discharged have not been treated. They are again prone to reinfection. Keep ready many lakh rupees for expenses or suffer forever, because one may also be infected with a strain or variant. Take your care for post-discharge from hospital or from isolation room on your own expenses. Then there are URLs for posts, about 44 URLs. Then there are video URLs, that is about 57. And now COVID-19 strain variant report update. Bharat public must think very seriously about how to achieve risk or loss prevention by application of required pertinent measures in relation to COVID-19 plus explosion, because nothing is being seriously done by our nation. This is no loss prevention method. Incoming vaccine shall not impart any recovery, treatment, solution or regular protection, but only certain immunity augmentation. Building or other items which always remain prone to fire, but if loss prevention methods are applied, loss to life and property can be minimized. So this also applies to COVID-19 plus. Possible magnitude of risk must be understood or evaluated by analyzing its power, and then based on analysis, practical application solutions must be searched and finalized prior to it is too late. COVID-19 strain variant has already spread in many countries such as our country, Bharat, Brazil, Canada, UK, or many more countries I don't know the name. UK PM ignored all such advices given to him by this, and they have been suffering. 1 in 5 is already infected, and 1/3 are asymptomatic. 20% population and 1/3 population is asymptomatic, which can also happen in our country, even though reports from ours are fact. People say that officials' reports from UK are too not reliable, and 100,000 people are expected to die there, with 3 or 5 million again infected. Bharat has crossed 1.057 crore cases of infection, and also 102 cases of variant strain have been reported from various parts in our country. This is old news, it is more now. Individuals out of 130 crores, only 18.709 crores, or only 14.392% population tested, and in 324 days, and 85.608% population certainly remaining untested. No worry for even COVID-19 strain plus on the government or on people of Bharat, India, as most people of our have become sheer careless, irresponsible and ignorant, whereas this problem has been rising every day since March 1, 2020. No plan is available for remaining 85.608% population who have been remaining untested, which has made it impossible to fix certain required milestones and schedule out prospective time-scale based plan to combat COVID-19 plus impacts. It seems a false contemplation of vaccine provisions. Government has neglected necessary ground organizations of initial testing to detect patients and provide them with mandated treatment. It's a must to have a concrete schedule or plan to control COVID-19 plus, just to avoid its powerful explosion that could cost crores lives directly and many crores additionally infected, and also give more post-discharge care, which may be required in 6 months' time post-discharge. Many discharged patients have reported back reinfection around the world, which include post-discharge care, but this aspect has been condoned or overlooked by government. It has been observed that more than 56% of those discharged after formal treatment did recontract symptoms of COVID-19 one way or other way. Testing speed has been very non-conducive, extremely unsatisfactory, which means no plan can be charted out of present state. Requirement of testing plans, inoculation plans, treatment plans, and post-discharge care plans are not available, as must be affected professionally, which missing details clearly indicate that we are a sleeping, inefficient nation. Real state of future of COVID-19 in Bharat, India cannot be correctly either forecast or predicted analytically in absence of such plans or schedules. In this connection, I had sent mails to government last year, but there has been no action, no information, nothing, so I condemn that. This such kind of irresponsible government, they don't even care what people write. Regretful it is, really. No change or accelerating program is visible, no pressure, any program is available. In fact, testing is still really outstandingly unsatisfactory, where government has always tried to reflect least number of positive cases by manipulation of data. No reported indication seems to be part of government to extend testing of whole population is concerned. And in case of no reliable data, no projections can be reflected. Government doesn't take any responsibility for testing of common citizens. It's assumed to responsibility of citizen itself. If one feels to go to a call laboratory or go yourself and get tested. Government has distanced itself from any public health responsibility. Total cases conducted up to yesterday, that's 17 January 2021, 18 crores 70 lakhs 93,036. Total tests conducted. And tests conducted on yesterday, the 17th January, is 5,48,168. 5 lakhs only. Shame on to our nation. We don't even test. We run away from tests. Total corona infections till 17th January 2021 is 1,05,71,773. We are happy here. We are showing less because we are not testing. Positive infected cases declared on 17th January 2021. 13,788. We are jumping, we are clapping, we are dancing. So we have come down only 13,700. What to do? All manipulation. Death update till yesterday, 17 January 2021, is 152,419, 1,52,419. And this is a record. I can't comment on this. Population test is 14.392% only since March 2020. Remaining population is 85.608 untested. Time required for whole population 1311 days, and time required for remaining population test is 1123 days. 1311 or 1123 days required days admissible. Do you accept that or not? It's up to you. It's up to you or your choice what to do, what to do. I can't say on that. Vice Governor, question is whether public has to accept or reject. Public has to consider this point very seriously in national interest. But public has been absolutely silent with no word to speak against government, reason being well understood. Vice government now improving its bad performance not clear. They don't respond and shall not respond at all just to protect its own skin. Government doesn't intend to speak anything in this regard. Government thinks that maintaining silence is best response, and if one is silent to 100 people cannot raise questions. Government has actually ignored poor lower class society members protesting. Why is government sleeping? I can't answer. Public is also sleeping. Unknown, worryless state of public. No seriousness seen anywhere. Explosion must occur. Government doesn't look anxious to test all citizens. Testing is unsatisfactory, very low, and they do not own any responsibility towards citizens' health. Why should people of Bharat, India suffer for none of their faults? Sufferers are poor only, not rich. And shall we allow it? Why are suffering people not raising voices? Their tongues are closed and locked under Modi's regime. They have become slaves practically. Why has government left this responsibility on the people on themselves? That's the question. Where's the fund going? Funds are collected. Where are they going? The question comes in. It seems that people shall not be tested because till now no such policy does exist, and we don't know what's policy. Government has not announced any such policy. Really speaking, there exists no government policy towards public handling of COVID-19 and strain plus. Test yourself, do yourself, whatever you want to do yourself. Poor people, there's no one for you to look after. You have to spend money on everything. Testing costs you 1,200 to 2,400. Then you have to make all expenses. Just keep many lakhs rupees with you because I don't know tell everything about how many expenses. It is written here. You can go and read it. 5-6 paragraphs are there. You have to test. You have to buy medicines if positive. You have to permit. You can say arrange your isolation room, or you have to join some hospital, admit into some hospital for treatment, where you have to spend money in lakhs. And if you are one, you have to many lakhs. If you have many, then you have to spend that time, number of times, how many patients are there. This is, you can say, nothing is going to happen, no one is going to help you. कोई सहायता नहीं करेगा, आपको खुद करनी पड़ेगी. पब्लिक सो रही है, पब्लिक मस्त है, गवर्नमेंट सो रही है, गवर्नमेंट मस्त है, किसी को कोई लेना देना नहीं है. कोविड अपना काम कर रहा है, करता रहेगा और करता रहेगा, कोई रोकने वाला नहीं है. इंग्लैंड बर्बाद हो गया, अमेरिका बर्बाद हो गया, यूरोप बर्बाद हो गया, लेकिन हम मस्ती में हैं. हम कह रहे हैं वैक्सीनेशन हो जाएगा. अरे कितने दिन में करेंगे आप ये तो बता दो, और उसका रिजल्ट क्या होना है हमको पता है. उससे कुछ नहीं हो रहा, ओनली एक प्रिकॉशनरी मेजर है. खैर, अब बकवास मैं ज़्यादा नहीं करता, मैं अपने आप को बकवास करना ही कहूँगा. फिर हम बात करते हैं आखिर क्यों, क्या हो रहा है. कैन यू डिपेंड ऑन व्हाट्स करंट स्टेट? दैट्स अ मेजर पॉइंट ऑफ व्यू. करंट स्टेट इज हॉरिबल, रियली हॉरिबल. You cannot wait for 1123 days. The government cannot provide you 1.22 crore cases testing per day, and immunity is also a question mark. They cannot inoculate 1.4 crore people per day. It's very clear, neither testing nor inoculation. It's out of your reach, so I can't answer. You have to suffer. And this seat 5, there is no solution. No solution here. Testing control, treatment control, discharge control and innovation. Till now nothing is consistent we can say. अभी तक ऐसा कुछ नहीं सरकार ने किया है जिसको हम कह सके बहुत बढ़िया काम है, और इसीलिए हमारे जो कमेंट्स हैं ये अभी भी वैलिड हैं। सो रहे हैं हम, पब्लिक सो रही है, सरकार सो रही है, मरने वाले मर रहे हैं, टेस्ट नहीं हो रहे हैं, इलाज नहीं हो रहे हैं। ये गाना गा दें और क्या करेंगे शायद हम, क्योंकि हम कुछ कर तो सकते नहीं, गा तो सकते हैं। भूख लगे तो गाना गा, गाना है ना, भूख लगे तो गाना गा, और प्यास लगे तो गाना गा, मरना पड़े तो गाना गा, मर के भी गाना गा, यही बात आनी चाहिए। खैर अब मजाक भी करना पड़ता है कई बार अपने मन को शांति के लिए। सच तो दिख रहा है कि कुछ नहीं हो रहा है, हमारे सामने है, और ज़्यादा बोलने का फ़ायदा नहीं। प्लान है ही नहीं तो बोलें क्या? देयर इज़ नो प्लान। उन्हें क्या लेना देना है, पब्लिक मरती है मरती रहे, कितने मर गए, 2, 3, 4, 5, 10 करोड़ मर भी जाएंगे तो सरकार की सेहत पे क्या फ़र्क पड़ने वाला है? कुछ फ़र्क नहीं पड़ने वाला है। अनुदान दे देंगे थोड़ी बहुत, वो खुश हो जाएंगे, बस इतना ही होता है इस देश में। और अब क्या कहें भैया, आप बताइए मुझे, हम क्या कह सकते हैं? ग्राफ अपनी आवाज़ उठा के चिल्ला रहे हैं, लेकिन कोई सुनने वाला नहीं है इस देश में, कुछ होने वाला नहीं है इस देश में। रोज़ रोज़ हम कहते हैं इतने रिसोर्सेज करो, नहीं करो, अभी तक तो ऐसा कुछ नहीं मिल रहा कि रिसोर्सेज बढ़े हैं नहीं बढ़े। नो इंक्रीज इन रिसोर्स, नथिंग स्टेस, नथिंग, गवर्नमेंट इज deaf and dumb, they do not hear anything is what's happening, and I do not talk a lot on this because you know what are facts। इसलिए मेरे दोस्तों, मेरे देश के नागरिकों, फिर कह रहा हूँ, अपना ख्याल खुद रखें, सरकार के भरोसे मत रहिए, अपना मोर्चा खुद संभालिए। कहीं ऐसा ना हो अभी आपके सदस्य परिवार 5 हैं या 10 हैं या 8 हैं, एक को लग गया तो बड़ी जल्दी सबको पकड़ता है। हम जानते हैं इस चीज़ को। क्वारंटाइन भी यदि आपने किया अपने एक के लगने के बाद तो भी कॉस्ट पड़ती है। वो कॉस्ट आप कहाँ से लाएंगे? आइसोलेशन आप कैसे करेंगे? अपने को कैसे बचाएंगे? मैं जानता हूँ सबको नहीं लगेगा, लेकिन चांसेस तो होते हैं। हम भुगत चुके हैं इसलिए बता रहे हैं आपको। अगर जिसके पास कमरा 1 या 2 है और मेंबर 6-7 हैं तो उनका क्या होगा? ये कौन सोचने वाला है इस देश में? जब कोई सोचने वाला नहीं होता देश में, समाज में, तो आपको सोचना पड़ता है अपने परिवार के बारे में, अपने बारे में, आसपास के बारे में, और उसके बाद यही आप कर सकते हैं। सरकार को बस वोट देते रहिए और अपना सेवा खुद कीजिए, ये ही कहता है आज का हालात। और इससे ज़्यादा मैं कुछ कहना नहीं चाहूँगा, क्योंकि ना तो आपने 3 वर्ष तक वेट करनी है, और वैक्सीनेशन भी इतनी जल्दी होने वाला नहीं है। उन्होंने स्टार्ट किया, लाख कुछ लगे, कोई कह रहा है बड़ी जल्दी प्रोडक्शन हो रही है, कुछ हो रहा है। मैं नहीं मानता इस चीज़ को, क्योंकि प्रोडक्शन बहाना, पॉलिटिक्स में आप देखिए कुछ भी बोल दीजिए, राजनीति में कुछ भी झूठ बोल दीजिए, लेकिन ना हम राजनीति की बात कर रहे हैं ना पॉलिटिक्स की बात, हम जो बात कर रहे हैं हेल्थ की बात कर रहे हैं। हेल्थ खराब तो देश खराब। 35 करोड़ लोग, 40 करोड़ लोग अगर कोविड हो गया, क्योंकि इम्यूनिटी भी रेस करने के बाद हो सकता है, जब डिस्चार्ज हो गए लोग उसके बाद भी उनको हो रहा है, तो वैक्सीन का भी कोई मतलब नहीं रह जाता है। क्योंकि लगे तो है ना, पहले कुछ दवाइयाँ तो खाई है ना लोगों ने, उसके बाद फिर हो रहा है। इसका मतलब ये खाली एक थोड़ा सा हेल्प लेने वाली बात है, और इससे ज़्यादा कुछ नहीं है। अब मैं सिर्फ इतना कहूँगा, हमें शर्म आती है अपने ऊपर, समाज के ऊपर, देश के लोगों के ऊपर, कि हम टेस्ट भी नहीं कर पा रहे हैं। इलाज तो दूर की बात है, वैक्सीन कब लगेंगे, क्या लगेंगे, मैं उसके बारे में कुछ नहीं कहूँगा, ना मेरे को पता है, और ना ही कोई प्लान गवर्नमेंट देती है। बस ड्रामेबाजी होती है, उद्घाटन कर दो, ये कर दो, वो कर दो, उस बात को दिखा दो, देखो कितना देश के अंदर सबसे तेजी से दुनिया में हो रहा है। अरे सबसे ज्यादा पॉपुलेशन है तो तेजी से होगा ना, इसमें क्या नई बात है? आपका 2-4 आदमी का रोज करेंगे, क्या मतलब इस बात का? अगर 130 करोड़ पॉपुलेशन है तो उसी स्पीड से होगा, इसमें बड़ी बात क्या है? आपने 1 लाख कर दिए, बड़े खुश हो गए। अरे 1 करोड़ होने चाहिए थे, लाख क्यों होने चाहिए थे? तो आप तो 1% सक्सेस हुए हैं सिर्फ। ये बात कह दो तो बड़ी कड़वी लगती है, कोई देशद्रोही कह देगा, कुछ कह देगा। यहां देश की बात नहीं है, हेल्थ की बात है, ये दुनिया की हेल्थ की बात है, मेरे देश की हेल्थ की बात नहीं है। खाली इस बात को समझिए, आपके साथ ड्रामा किया जा रहा है, समाज भी ड्रामा कर रहा है, देश की पब्लिक भी ड्रामा कर रही है, और सरकार तो ड्रामा कर ही रही है। हमें दुनिया को नहीं दिखाना कि हमारे पास कितने कम केस हुए हैं, नहीं, क्या फायदा उससे। हमें यह देखना है कि हमारी प्रॉब्लम क्या है। क्या हमारी प्रॉब्लम अमेरिका सॉल्व करेगा या यूरोप सॉल्व करेगा? हमें खुद सॉल्व करनी है। हमारी पब्लिक ज्यादा है भाई, सबसे ज्यादा है, तो प्रॉब्लम उतनी बड़ी होगी, इसमें छिपाने की क्या बात है? आप कहते हैं देखिए हमारे पास सिर्फ 13,700 केस हुए हैं। अरे टेस्ट करेंगे तो पता लगेगा ना। अभी तक आपने 14-15% टेस्ट नहीं किया, बातें बड़ी बड़ी कर रहे हैं आप। पता नहीं कौन से माउंटेन के ऊपर बैठ के आप देख रहे हैं या 60वें आसमान से आप देख रहे हैं, आपको कुछ समझ ही नहीं आ रहा है। बस सरकार चलाना इतना आसान नहीं होता है, एनालाइज करना पड़ता है, समझना पड़ता है। आप एनालिसिस तक नहीं दे पाए आज तक। कितने दिन से मैं डाटा के पीछे पड़ा हूं, आज तक मैंने आपका एनालिसिस नहीं देखा, मैंने कोई स्कीम नहीं आपकी देखी, कोई प्लान नहीं देखा, कोई कंट्रोल नहीं देखा आपका। बस बोलते जाइए बोलते जाइए बोलते जाइए। दुनिया में न्यूज़ निकाल दीजिए ताकि सब लोग डाटा नहीं देखेंगे, खाली न्यूज़ देखें और खुश जाएंगे। देखिए सबसे कम केस हमारे देश में हुए हैं, सबसे कम मौतें हमारे देश में हुई हैं, सबसे कम इन्फेक्शन हमारे यहाँ हुए हैं, और सबसे तेजी से, सबसे ज़्यादा, दुनिया के सबसे फास्ट वे में हम वैक्सीनेशन कर रहे हैं। ड्रामा है, करते रहिए। सच्चाई तो छुपेगी नहीं। जब बाढ़ आएगी तो पानी सड़क पे आएगा, आप कुछ भी कर लीजिए रोक नहीं पाएंगे। डैम भी टूट जाते हैं, मकान भी हिल जाते हैं। आप कैसी बातें कर रहे हैं? गुस्सा आता है इसलिए कर रहे हैं। कितना कह चुका, समझा चुका, कोई सुनने वाला नहीं है इस देश में। सरकार तुम्हारा URL तक नहीं खोल के देखती है, जवाब तक नहीं दे। अरे यही कह दे कि आप ये वीडियो मत बनाइए, वो भी नहीं कह सकती है। वो जानते हैं कहेंगे तो फंस जाएंगे। लिखने के बाद URL भेजिए, समझाया ऐसा हो रहा है, लेकिन कोई सुनने को तैयार नहीं है। वही रोज रोज का नौटंकी भरा एक ड्रामे का डाटा दे देना, बस हो गया काम हमारा, हमने सरकार का काम कर दिया, डाटा दे दिया, बात खत्म, पब्लिक अपने आप को संभाल ले। इसे ही कहते हैं सेल्फ रिलायंस। देश का नागरिक अपने आप को संभाले, सेल्फ रिलायंस का यही मतलब है, बाकी कोई मतलब नहीं है। और जिसको भी बुरा लगता है लगे, आपका धन्यवाद कि आपको बुरा लगा, क्योंकि सच्चाई तो बोलनी पड़ेगी। मुझे राजनीति से कोई मतलब नहीं है, ना मैं किसी पार्टी का हूं, लेकिन देश की जनता का तो हूं ना, देश का नागरिक तो हूं ना। जैसे आप वैसा मैं आपकी सहायता कर रहा हूं समझाने के लिए कि डाटा ये बोल रहा है, मैं नहीं बोल रहा हूं, मैं तो आगे समझाने की कोशिश कर रहा हूं। थोड़ा टाइम लगता है, लगे कुछ होता है होए, लेकिन आप भी अगर इंटरेस्ट नहीं लेंगे तो मैं क्या करूंगा? ठीक है, जितने लोग देखेंगे देखेंगे, जितने समझेंगे समझेंगे, नहीं समझेंगे नहीं समझेंगे। कोई जोर जबरदस्त तो है नहीं, मैं कोई नेता तो हूं नहीं कि मेरे पीछे लोग आएंगे देखेंगे देखो इसने क्या दे दिया। नहीं आएंगे, मैं जानता हूं, लेकिन मुझे उसका भी दुख नहीं है, आए ना आए। लेकिन आंकड़े होते हैं, देखने वाले चुप हो जाते हैं, बोलते नहीं है, क्योंकि वो भी जानते हैं क्या जवाब दें इसका। सही तो दिया है आंकड़ा, और जब आंकड़े सही होते हैं तो बड़े बड़ों की अकड़ ढीली हो जाती है, उसमें चाहे राष्ट्रपति हो या प्रधानमंत्री हो, सबकी ऐसी की तैसी हो जाती है। क्योंकि सच्चाई छुप नहीं सकती झूठे बनावटी असूलों से। जानते हैं ना आप ये गाने को? कागज के फूल काम नहीं आते, दिमाग की शक्ति काम आती है, सच्चाई की मेहनत काम आती है। इस बात को आप जितना जल्दी समझ लेंगे उतना अच्छा होगा। अब मैं ज़्यादा नहीं बोलूँगा, यहीं पर इस बात को क्लोज करूँगा। और आपका धन्यवाद। अगर